muscle relaxers actually work, and are they safe? We're going to talk about that today. Hey, I'm Dr. Nate, and welcome to my channel. I help people overcome back pain and other injuries and live a super high quality life. So let's get into it. We're going to look at this paper today, Considerations for the Appropriate Use of Skeletal Muscle Relaxants for the Management of Acute low back pain. All right, so, by the way, I'm a physical therapist and business owner, just throwing that out there. So we're going to look through here. I wanted to highlight something here. Okay, so just getting right to the point, a systematic review indicated that skeletal muscle relaxants were effective in the short-term relief of acute low back pain when compared with placebo. However, these agents were associated with a 50% increased risk of adverse events, side effects, with a relative risk of 1.5. So, and the actual things that happen, the side effects would be like sedation, headaches, blurred vision, and dependency with the use of these agents. So the main thing that this paper was looking at, and you can literally type this into Google and watch, or not watch, you can't watch it, but you can read it on Google. It's free, like you can download the PDF and everything. So as you can see in this one here, in this paragraph, I'm gonna read this. Essentially, I will summarize it first, but summary, first line of defense for low back pain is, rest a couple days, take some NSAIDs, start moving more after like day 1 or 2, and in 4 weeks, typically things will clear up. Sometimes they don't. Muscle relaxers should not be the first line of defense, even though, as we can see here, although they are not recommended as primary treatment, 35% of patients are prescribed muscle relaxants, and 18.5% receive initial muscle relaxant therapy, even though it does not necessarily meet the standards for that first line of defense. So there are first level things that we should do for back pain, and then if it's not working, we can go up to second level. And these are for short-term use. They're not meant to be used long-term. So I know I've had clients who've been using muscle relaxers for like years, and they still have issues, like still have back issues. So they're just literally just taking the medication, and it's not even helping. So just make sure, like if you're doing that, you need to talk to your doctor. Ask them if you can adjust your medication as appropriate, of course. But long-term use of muscle relaxers, we don't necessarily know the long-term side effects. We don't know the long-term side effects yet of that. We don't have like long-term studies on that I have seen. I'll keep scouring the interwebs for them. But again, like as it talks about here, given the frequency of use, the questionable role in the treatment of back pain, and the potential for misuse, using it for a really long time, getting addicted to it, it is imperative for clinicians to be aware of the facts regarding commonly used muscle relaxants in the United States. So, and this is important for you to know as well, right? The client, the patient. So educate yourself so that you're not falling into the trap of just being addicted to different medications here that aren't actually working for you. So I'm going to read this concluding statement here. It's pretty much a summary of everything. So skeletal muscle relaxants are effective agents used for the management of acute, nonspecific low back pain. However, the risk of adverse drug events raises concern for their safety in routine use. In the past decade, the overuse of some agents has grown drastically, like opioids and such, with an increased incidence of adverse effects. In addition to sedation, patients may experience headache, dizziness, blurred vision, nausea, and vomiting. So definitely not for everybody. So this is really important to look at here. Medications in this class are commonly used to treat acute musculoskeletal back pain, but they are often taken in higher quantities and for longer durations than recommended. Since evidence supports their use only for acute low back pain, they should be for temporary pain relief. This also prevents the extended masking of any underlying conditions causing the back pain. So, like I was saying before, they can be used in the short term, right? Based on what the literature has to say. But if you're having really bad side effects, it's not really helping you, and you're using it in the long term, like, it's just not effective. And I'm going to go over other medications like this, like gabapentin and opioids and all of that, because I haven't seen a lot of great videos actually going through what the research actually says. Everyone has their opinion, but what does the research say, and are they showing it to you? So, and of course, as new research comes out, we want to update our perspective. So it is very possible that more research will come out and they will say, hey, yeah, actually it's fine for long-term use. But we can't necessarily make that assumption. We need to go with what we have right now. And then as more research comes out, then we can make adjustments to our line of reasoning. And, it's possible I could have missed some papers that they're saying something different than this. But there weren't a ton of papers discussing this. So I'm pretty sure I looked at all of them. And this one makes a good synopsis of the current state of literature. So hope this was helpful for you in kind of making a decision of whether you want to use muscle relaxers if you need it. If you need to have a discussion with your physician, go do it. Like this video if this was helpful for you. I will make more videos like this, so you can hit that bell for the little bell on this side, I think, to ring you or ping you when new videos come out, so you won't miss it, because YouTube's just burying videos at this point. And hope you have a great rest of your day. Stay strong, stay resilient, and keep getting after it.